Good morning, everyone, and greetings from sunny Southern California. My name is John Viola, and along with my partner, Art Silbergeld, as well as the entire Thompson-Coburn family, I want to thank you for attending today's webinar, Getting Back to Work in a Pandemic Environment. Before we get started, we need to cover a few housekeeping items. First, if you have any questions during this webcast, please submit them through the question and answer widget you can see at the bottom of your screen. We'll try to answer questions at the end of the webcast, but if a fuller answer is needed or if it's more likely we run out of time, we'll answer your questions later by email. In addition, a copy of today's slide deck is available on the resource widget. We encourage you to download any resources or links, and you'll see some links as we go through the slide that you might find useful. You can also find additional answers to some common technical issues located in the Help widget that's also at the bottom of your screen. And importantly, this webinar has not been approved for CLE credit. We appreciate your participation in this course, and we thank you. So let's get started. Returning to work. First and foremost, when you're considering a return to work back in the physical workplace, because we're mostly all working remotely now, you'll want to make sure you're allowed to do so under state and local laws and ordinances. From where I'm speaking right now in Los Angeles, for example, you can only reopen an office setting business if teleworking is not possible. So if you're not an essential business, or if your business has not received permission yet to reopen, please make sure you can reopen your in-person work site before you do so, because we have received reports of employees complaining that certain businesses have opened even though they're not allowed to do so. Okay, one of the most frequent questions we've received during the last couple of months with the pandemic is whether you can fire employees who refuse to return to work. Generally speaking, the answer is yes. Employment across the country is considered at will, meaning that employers can fire workers for pretty much any reason, or for no reason at all, at any time, with or without notice, or with or without cause. Unless, of course, the worker has a contract stating that he or she is not at will. But there's a caveat here. An employer, of course, can't fire an employee for discriminatory reasons. And in this regard, with respect to the pandemic, you may see employees who seek to avoid returning to work under the Americans with Disabilities Act or under state law equivalents. Under the ADA and in California under the Fair Employment and Housing Act, known as FEHA, employers must provide disabled employees with reasonable accommodations which will allow them to perform their jobs in light of a disability. So, if an employee has a medical condition that puts them at high risk for COVID-19 or for complications, you may have to allow them to leave work or to work remotely even after you return to your in-place work site as a reasonable accommodation. Workers may keep collecting unemployment benefits if they refuse to return to work because their workplace is unsafe and therefore unsuitable. So how do you determine if a workplace is unsuitable due to COVID-19 safety concerns? That, of course, has not been decided. And in a few minutes, Art's going to discuss some of these health and safety issues. Another question we frequently are asked is, how does an employee refusal to return to work affect my loan forgiveness under the Paycheck Protection Program? The PPP requires that employers maintain their full headcount, 100% of FTE, for the loan to be completely forgiven. Well, in recent weeks, an exception has been carved into the Paycheck Protection Program to deal with this situation. PPP loan forgiveness will not be reduced if the borrower laid off an employee, offered to rehire that employee, and the employee refused the offer and refuses to return to work. But you must be able to prove that you made a good faith offer of reemployment to the employee and you should be able to document that that employee refused the offer. So here's what we recommend that you do. Make any offer to return to work to employees in writing. Include salary information that provides the employee's wage will be substantially similar to what it was before the layoff or furlough. Include a clear date by which the employee must respond, with a notice that failure to respond will be treated as a refusal to return to work. And last, but certainly not least, include a statement that an employee's refusal to work back at the in-place workforce may result in the individual being ineligible for continued unemployment benefits. What happens if an employee tells you that she or he cannot come back to work because they have to take care of family members or don't want to expose an ill or elderly family member to the coronavirus? Well, the Families First Corona Response Act, the FFCRA, requires employers with less than 500 workers to provide short and long-term leave to workers who can't work because of the virus. Certain local jurisdictions, including in California, Los Angeles, and San Francisco, have expanded this requirement to include employers with 500 or more employees. So this is an exception to the so-called big box exception, at least in San Francisco and Los Angeles. Now, under the FFCRA, employees may receive 2 weeks of full salary, capped at $511 a day, if they're subject to a government isolation order, their doctor has told them to self-quarantine, or if they have COVID-19 symptoms. An employee can also receive 2/3 of their pay, capped at $211 a day, to care for family members subject to quarantine orders or children whose schools have closed. I mean, the school issue right now obviously shouldn't be an issue at this time of the year, with most schools, if we were in a normal environment, would be closed for summer vacation. In addition, if employees will be taking additional time before entering the workplace for doing things for health and safety reasons, as Art is going to discuss in a few moments, such as temperature checks or filling out safety forms and health and safety questionnaires, you're probably going to have to pay them for this additional time it takes before they enter the workplace. I mean, in California, you most definitely have to pay them. And although there's been no guidance yet from the U.S. Department of Labor or other state labor departments, the prevailing view at this point appears to be that you should pay employees for that additional time. Let's face it, this is a pretty stressful time for everyone, much more so than usual. And many employees are feeling that they're isolated and they're stressed out and coping, not just with the new working environment, with teleworking and social distancing and transportation issues, but with the current health and safety situation. So you may ask yourself, how do I keep my employees' morale up? How do I keep them productive while teleworking? How do I keep them from leaving because they're so stressed out? One thing you might do is try to keep in regular, continuous communication with your employees, such as having phone or video meetings, sending memos and email messages from management and team leaders and the like. You also should try to make sure that your communications to both remote and in-person employees are consistent, especially if you're implementing a staggered return to work, as many employers are. You should provide frequent and consistent updates to all employees, especially remote workers, regarding key business developments or changes in practices or policies. You also should make sure that your remote employees are provided with equal notice of professional opportunities such as promotions, incentive programs and bonuses, and events you may be hosting. In other words, just make sure you treat all employees equally, whether they're working physically in place at your facility or they're continuing to work remotely. Okay, so I know that many employers have laid off or furloughed employees over the last several months due to the COVID-19 pandemic. But now, with business starting to return to normal, or I should really say a new normal, and the stay-in-place orders gradually being lifted, you're ready to start recalling some of your employees back to work, but maybe not all of them. There's some pitfalls you need to avoid here. First, of course, you need to make sure that you don't discriminate on the basis of age, gender, race, national origin, disability, or any other protected status in deciding who you're going to bring back to work and when you're going to bring that person back to work. You probably should carefully document the reasons you decide to recall employee A instead of employees B, C, or D, and make sure you maintain this documentation in case the government comes a-calling or you get sued by a disgruntled employee. Another thing you need to carefully navigate is this issue that we're all faced with now of employees who are over the age of 65 or those with certain serious underlying health conditions who may be more susceptible to contracting the COVID-19 virus. You might be liable under the ADA or state law if you refuse to recall to work disabled employees or employees who you believe have serious health conditions and have a purely altruistic concern for their health. The EEOC has issued a guidance which relies on the Center for Disease Control guidelines concerning high-risk individuals. Under these guidelines, for employees with serious medical conditions such as chronic lung, heart, kidney, or liver disease, severe asthma, severe obesity, and immunocompromised systems, the CDC encourages employers, quote, to support and encourage options to telework if available, unquote, and to offer such workers duties that minimize their contact with customers or other employees. Well, you might be asking then, well, if I can't ask an employee if they have a serious medical condition, what do I do in this situation? I know the person has a condition. The answer is that you've got to handle any disability as you would before the pandemic. You need to determine if the employee needs a reasonable accommodation and engage in the interactive process, as you normally would. And importantly, the employee should initiate the process, not you. The EEOC has clarified that employers may encourage employees to notify them in advance of a return to work if they have any serious medical conditions that may be impacted by the virus. One last thing before I turn it over to Art for a discussion about health and safety issues. Many of our clients have asked, what should they do about travel, both for employees for whom travel is a business necessity and just for employees who travel for personal reasons, such as vacation or taking a few days off and going out into the country. Many employers, of course, already have restricted non-essential work-related travel, but travel might be an essential part of some employees' job functions. You might want to consult the CDC's information for travel for guidance for the latest updates on the risks presented by the virus in different countries and in the various states. And as far as personal travel goes, various state laws prohibit employers from restricting employees' personal travel. For example, some states, such as California and New York, prohibit employers from restricting lawful employee activity outside of the workplace and outside the scope of employment. Other laws, such as the FMLA and state equivalents, require covered employers to allow employees to take time off to care for sick family members, which may be the reason for an employee's travel to an area affected by COVID-19. You also should be aware that if you discipline employees who travel to affected or high-risk areas, that you may risk exposure to claims of discrimination on the basis of race, national origin, etc. So instead of prohibiting personal travel, the better practice is to ask employees to notify you if they are traveling to affected areas. You should also inform your employees that if they do travel to an affected area, you may ask them to self-quarantine, even if they are asymptomatic when they return. And with that, I'll turn it over to Art to discuss OSHA obligations.
Health issues are absolutely critical in looking at your workplace. The COVID-19 virus has created an environment of fear because of the exponential ability of one person to transmit the virus to numerous other people and the multiplier that occurs. First and foremost, you have to consider your OSHA obligations under the Labor Code. Cal OSHA is found in Labor Code 6300. There is a general duty clause that requires maintaining a workplace that is safe and healthful for all employees. OSHA creates a duty to provide safety equipment that employees need in order to do their jobs. And OSHA creates a duty to impose safeguards that are necessary to ensure a safe workplace that does not expose employees to injury and illness. The primary consideration that a business should have in mind that supersedes any other consideration when employees are getting back to work and issues arise is what is in the best interests of the safety and health of all of the employees. That standard gives the employer the right to exclude anyone who has COVID-19 or its symptoms from coming into work because their condition poses a direct threat to the health and safety of others. Temperature checks are almost universal. The EEOC has stated that because of the health risks of the virus pandemic, employers are permitted to take the temperatures of employees as they come into work. And this creates a number of issues. Point one, for how long are you going to have to do these temperature checks? The answer is probably for as long as the vaccine is under development and not available. Once it is, then you can consider, if everybody has been vaccinated, you can consider stopping doing the temperature checks. At the moment, how often do you have to do it? I would recommend every day, every shift, and if employees go out for lunch, even when they come back in. Point two, someone has to be assigned the task of taking temperatures. That person needs to be specifically trained on the safety and privacy protocols, and the company should give the task of taking temperatures as employees report to work each day to only one or two people, probably two people, so that one person doesn't have to do all of the temperature taking. The company should expect that the tester will be exposed to someone who tests positive or reports symptoms. Therefore, the tester should have the proper personal protective safety equipment, including gloves, gowns, a plastic face mask or shield, masks underneath that shield, and a hand sanitizer. The tester should be provided with multiple digital thermometers that do not touch the forehead and alcohol wipes in the event that touching of the forehead occurs. They should know the other physical and medical symptoms of the virus that they might observe: fever, chills, difficulty breathing, coughing, and sneezing. Point number three. The employees who are testing should be relieved every once in a while and be able to go to a testing center. Because of the frequency with which they are exposed to employees, they should be tested regularly, probably once a week, to determine if they have contracted any of the symptoms or test positive. Next point. The EEOC has stated that companies can ask employees questions that are related to the COVID-19 virus. An employer generally and the designated testers individually can lawfully ask all employees if they have had or have the virus or any symptoms related to it. They can ask each individual if they have had contact with anyone who has had the virus or symptoms, not just limited to family members with whom they may have been sheltered at home. Next point is the company can choose to have employees entering the building complete a written questionnaire asking about the list of symptoms, including intestinal issues such as nausea, diarrhea, and vomiting. This information, along with any log that the tester keeps, indicating which employees have been tested each day, should be kept in a separate file. All of this information has to be treated with confidentiality, and the employee can be told that it will be, except to the extent that a designated person must report the information to health officials, which you probably want to do if you have someone who has all of the symptoms or one or two of the symptoms at least, including a high temperature over 104. 100.4 Fahrenheit, which is considered a fever. And if somebody has a temperature in excess of 100.4 Fahrenheit, a second reading, probably with a separate digital thermometer, should be taken by the tester. The tester should know what to do if an employee is coming in and has the symptoms or an elevated temperature. Rehearsing different scenarios in advance with a designated tester can prepare him or her for problem situations. For example, the tester needs to know what if an employee says that he can't come to work that day, but he has to work. He understands that he may have symptoms, but he says he's got a hungry wife and kids at home, so he has to work, and he refuses to go home. Or what if the person refuses to answer questions about whether he has had virus symptoms? The tester should be prepared to respond firmly that an individual can't come to work if their temperature is elevated or if they can't answer the questions that the tester asks. The tester needs to have backup, a more senior manager who can come out and explain why the person needs to leave, and that if the individual refuses to leave, that they are trespassing and the police may need to be called. It's a bad idea to threaten job loss, which would risk a claim of retaliation, so you don't necessarily want to go there. As the summer rolls along, some employees are going to want to skip testing because they've presented evidence to you that they've been tested, and they have COVID-19 antibodies. Should they get a free pass? At this time, the evidence suggests that these tests are not foolproof. There is no guidance from the CDC or OSHA on this issue, and the better practice is simply to test everyone. Let's talk about notice requirements. For companies that are operating in California, under the California Consumer Privacy Act, notice must be given at the time that this information is collected. In other words, the tester needs to have the notice available, and each employee should be given the notice on the first day he or she is tested, and the tester should check off that the notice has been given. If you have any questions about the notice, Luke Sosnitsky in our office can be reached either at his website, lsosnicki@thompsoncoburn.com, or directly at 310-282-2538. And Luke can provide you with a copy of either a template notice or he can tailor one to you. And this is an example of the notice that'll be in your materials. Face mask. We're probably all familiar with the face mask. Again, because of the safety and health of all employees being primary, the EEOC on April 17th stated that an employer can require employees to wear protective gear, including masks and gloves. An employer may refuse to allow employees to report back to work and to be at work unless they are wearing an appropriate mask at all times. N95 masks are the most protective. Manufactured composite masks are less effective, and cloth masks are even less effective. So each employer is going to have to decide what it is going to require and be willing to pay for, because most employees have their own face masks, and employers may be inclined to allow employees to wear their own cloth face masks. They're washable. They need to be washed every day. The employer should tell the employees, if they're going to allow the use of cloth masks, that they need to be changed or washed every day. But that's an important point for every employer to take into consideration. How are you going to enforce this? It's probably not possible to compel wearing a face mask at all times. For example, an employee is going to need to remove the mask from time to time in order to eat, get a drink, or even to talk to a group. There is no notice requirement that's been created by any governmental agency with respect to taking temperature and wearing masks, but you probably should create your own posting, both at the point where the tester is testing temperatures and inside and all over bathroom spaces, cafeteria spaces, and employee bulletin boards. What do you do with employees who are exhibiting symptoms? For instance, you've got an employee who comes in and you recognize that while he's at work, he's starting to cough, he's starting to vomit, God forbid, or has other symptoms. The company may be, and that person is sent home. The company may be obligated to notify employees, co-workers, vendors, and clients that the employee has had contact with over the prior years, that the individual now has those symptoms. If an employee has been absent because of having symptoms, when the employee is returning, the employer has the right to ask for a fitness to return certification from a physician or other healthcare provider. Social distancing is probably the biggest challenge that any employer is going to have. The many reports have discussed a number of the topics, which I will mention briefly. First, there are opportunities to spread out employees. Moving desks around, placing plastic curtains between employees, using available empty offices, and the like. Each workplace will find its own opportunities and limitations in order to social distance workers. Second, the employer should control access to common areas by more than a few people at a time whenever possible. Employees should be told to look ahead at a coffee or water station and vending machines and stay back until there's no occupant at those locations. Common eating areas should probably be abandoned, and restrooms in particular present a difficult issue. Employees should be told to monitor how many people are in the restroom at a time. You may want to set up a numbering system so that an employee who wants to go into a restroom knows how many people are in there. Employees should be told that they have to wash their hands for 20 seconds when touching common surfaces, and a notice to that effect should be posted. There should be hand sanitizer available in the restroom and at reception stations, and perhaps at choice locations around the office. Until a vaccine is available, holding conferences in traditional room settings creates a separate risk. Even when all employees are back at work, having Zoom or WebEx meetings among the employees who are present for both business and social events should be considered. Finally, John has already talked about some of the issues, but I want to point out one area of liability for employers that need to be taken into consideration under the California Workers' Compensation Act. Governor Newsom in April issued a strange order affecting workers' compensation proceedings. It says that there will be a rebuttable presumption that an employee who has a workers' comp claim based on COVID-19 and was working prior to the time the symptoms appeared at work has a rebuttable presumption that the workplace caused the individual's virus. This is something that's not been seen in any other state. There's room to doubt the authority of the governor to issue such a regulation, but it's out there, and your insurance companies that provide workers' comp are likely to challenge it in the court, but you should be aware if there is a claim under the Workers' Comp Act that your insurance company needs to be notified, even if you regard it as a ridiculous claim. John?
Thanks, Art. And you're speaking about liability for a minute. Obviously, other than Governor Newsom's executive order, it's going to be pretty difficult to prove causation that a worker contracted COVID-19 in the workplace. But one question we are seeing is whether an employer can absolve itself of liability by having employees sign waivers. For example, many employers are concerned about workers' comp claims based on an employee's belief that he or she may have contracted COVID-19 in the workplace. And so, you know, causation issues aside, because I don't know how you would have approved this other than this presumption in California, in most states you cannot waive the right to workers' comp benefits by having an employee sign a release or a waiver. And similarly, any other type of waiver as to future damages to an employee also are likely to be held to be invalid. So the answer is no. you really can't avoid potential liability by having an employee sign a waiver as a condition of their new or even continued employment. So let's turn now to remote working issues. I mean, we've all been doing this now for a while, and some people are either to continue to do so, either voluntarily or involuntarily. In light of the social distancing issues that are talked about and the new space requirements dictated by social distancing, by employers' own business needs, and the like. So the question is, after stay-in-place orders are lifted and we return to a somewhat normal environment, can you require employees to telework even after you resume normal operations? The answer to that is yes. The United States Department of Labor has confirmed that you may require employees to telework as an infection control or infection prevention strategy. This would include situations in which you impose such an arrangement based on current information from the CDC or even from state or local public health authorities, some of which, for instance, in Los Angeles County, have gone above and beyond what the CDC recommends. And of course, as we discussed briefly earlier, teleworking also may be used as a reasonable accommodation under the ADA. Now, when you decide if only some employees, but not all employees, will or will not be allowed to telework, you need to be careful and make sure you don't make decisions on who's required to and who is not allowed to telework based on protected characteristics such as gender, race, age, national origin, and disability. We have already handled, well before the pandemic began, cases and claims regarding this issue of who or who will not be allowed to telework, and we can only expect these type of claims to become more frequent as we go on in the future with more people working. And I probably shouldn't even have to tell you that the EEOC and also the New York State Department of Human Rights have seen an increase in these claims already. We're only 2 or 3 months into this new situation. For many of us on this call, remote working may be the new norm, at least for some employees and at least some of the time. But we need to remember, just because an employee is working at home or from some other remote location by teleworking, that does not mean that the usual wage and hour requirements that apply in the in-place workplace fly out the window. You still need to make sure you're complying with all wage and hour requirements for non-exempt employees, including such issues as overtime, off-the-clock work, and meal and rest breaks in states which mandate them, such as California and meal breaks in Illinois. Make sure you've got a procedure so that employees can record their time and clock in and out while they're teleworking. And I know this is a challenge in dealing with remote workers, but you need to require and make sure that all non-exempt employees have properly and accurately documented all time worked to avoid any wage or hour problems. And you can have them clock in by computer. So if you don't have them already, you should make sure you have clear policies prohibiting employees from working off the clock, no matter when or where they're performing work, and a clear way for employees to record their time. Managers and supervisors should review employee timekeeping and make sure that time is being entered and reported correctly. Remember also that whether people are working on-site or teleworking, employees need to be paid for tasks for all work. They need to be paid for all work done, including tasks that may take only a few minutes, such as checking emails or responding to phone calls after normal working hours. You should remind employees that while they're going to be paid for all such time, they may be disciplined, including having their employment terminated for unauthorized off-the-clock or overtime hours. And for those employees who don't have their own equipment, under the law of California, Illinois, Massachusetts, Montana, and of course, New Hampshire, you may have to reimburse employees for computer and phone equipment needed so they can work at home, plus any additional phone, internet, or other expenses incurred to enable the employee to telework at the employer's request. In fact, under a Ninth Circuit decision that was issued just 3 months ago, California employers may be required to pay employees a reasonable proportion of their cell phone or internet bills, even if the employee already was planning to pay for those services for their own personal use. One more thing on this topic, productivity. Monitoring productivity of remote workers is, let's face it, pretty challenging. If there are any issues with employees getting their work done, try to find out what the reason is and come up with a solution. It might be as simple as equipment problems, such as internet outages or not having the proper modem or other computer equipment. Or it might not be. If an employee has productivity issues while working remotely, and let's face it, we all have a lot of distractions while working at home. We've all been on calls during the pandemic with babies crying and dogs barking and things like that. But if you have problems with employee productivity, you may want to require that employee to work on site instead of remotely. You also need to be aware as an employer that in some jurisdictions, you might not be able to revoke employees' ability to work remotely in certain cases. Some states' COVID-19 orders, specifically those in Colorado and Indiana, either prohibit or suggest that you cannot require quote-unquote vulnerable employees, such as those at or above the age of 65 with serious medical conditions, to return to in-person work. I think we're going to see a huge increase probably in employees requesting teleworking arrangements, even as business reopens. So if you've not done so already, you should adopt a clear written teleworking policy. And you might want to consider entering into teleworking agreements with employees in order to set clear expectations while people are teleworking. Finally, and I know we're running out of time here. In fact, we've run over already. Let's talk about reporting requirements. As you can see on the screen, there are reporting requirements under the Families First Corona Response Act that have been posed as a result of the pandemic and, of course, in the normal course of business in California. If anything can be considered normal out in California. If you have less than 500 employees, you must post the FFCRA notice regarding COVID-19 paid sick leave benefits. You can download this poster for free from the DOL website at the URL address we show on this slide. You don't have to physically post the notice as a poster, say, in your lunchroom if you don't want to, or because you have remote employees who won't be able to view a notice in a poster form. You can email the notice to employees, or you can post it on an internal or external website. And for California employers, or indeed in other large cities across the country that have enacted their own ordinances providing for additional COVID-19 sick pay benefits to employees of employers with more than 500 employees, make sure you post these required notices as well. And one last thing on posting. If you're in California, you're aware that many California cities have their own minimum wage requirements, which are higher than the state minimum wage. And some of these cities are implementing minimum wage increases effective July 1. Please make sure, if you're in California, that your posters are up to date to reflect these wage and hour increases that will be effective in only a couple of weeks. Unfortunately, we've run out of time for questions. We will get back to you by email. And Art and I would like to thank you for participating in this webinar. If you have any questions you haven't already submitted, or you'd like us to speak with us further, please contact Art or I at the telephone numbers or emails shown on this slide. This concludes today's presentation, and we thank you again for listening and joining us today. Thank you.